I welcome you to this online tutorial. My name remains Matthew Ocheleka Itodo, and we'll be looking at the role of the lungs in acid-base balance. What is the role of the lungs in acid-base balance? Each time we mention the lungs, your mind should go to respiratory systems. And so the role of the lungs to balance acid-base is serve as an immediate available temporal mechanism. The mechanism is not forever, it is available temporarily to maintain acid-base balance. And this is how it operates. The lungs did not do the work itself directly, but it affects what? It alters carbonic acid. The carbonic acid, you all know what is carbonic acid, it's a weak acid. And each time we are mentioning carbonic acid, your mind should go to what? Bicarbonate buffer. So the lungs, the way we balance acid base is by altering carbonic acid component of what? Bicarbonate buffer. So this carbonic acid depends on pressure of CO2 or carbon dioxide in plasma. So which is in turn controlled by the lungs. We move further. So in lungs, carbonic acid formation is from what? Carbon dioxide and water. Okay? Through the help of an enzyme called carbonic anhydrase. Now this is our weak acid, carbonic acid, and this is our what? Carbon dioxide and what? And water. So if we want to have our carbon dioxide, there must be what? Pressure of CO2, okay, which is already in blood plasma, and there is a dissolved, there is water, the body fluid there in blood plasma. So with the help of an enzyme, this carbonic anhydrase, well, we will have what? Our weak acid, carbonic acid. That's what we are talking about. And so now, when the blood pressure becomes acidic, the plasma hydrogen carbonate concentration decreases, and the ratio of this hydrogen carbonate ions to carbonic acid also decreases, and so the body becomes in a state of what? Acidosis, acidotic respiratory center is stimulated, because the body is already in the state of what? Acidotic state. So this respiratory center is what? Stimulated, and it is the body will be in the state of hyperventilation. Okay, so more of this CO2 is blown off. What we are saying is this. Now the body, the blood is already in the state of acidic, and so the acidotic state respiratory center is stimulated because the body is already in danger. And so we also know that the ratio of this hydrogen carbonate to carbonic acid, the ratio is less. That's what I mean by decrease. The ratio is already less. Means there is more of this guy acid in the system than this conjugate base already. And so the body is already in a state of what? Acidosis, means in acidic state. And so because of that one now, there will be hyperventilations. Yeah, okay, if hyperventilation it increase, so that the breathing will become very fast, and so carbon dioxide is what? Is breathed out, is blown off out of the system. So when this happens, it decreases the pressure CO2. You know, this CO2 is the one that formed this acid, this weak acid. So now, because this guy, carbon dioxide is blown off, now there will be less pressure CO2 in the system. Okay? So, and this, and the ratio of this hydrogen carbonate, which is the conjugate base, will increase because this one have been blown off. Okay? And the blood pressure will return to normal pH of 7.4. That is how the lungs affect to balance acid-base balance. But whereas when the blood pressure increases, when the pH of blood increases, makes the body try to move towards alkaline, know that there is decreased hydrogen ions. Okay? The body is moving towards alkaline, means the conjugate base is much. Is that also? So it means there will be what? There will be decreased what? Hydrogen ion concentration in blood. And so CO2 is also acid. So because of that one, there will be less acid in the systems. Okay? And so what will happen? The body will run to the state of what? Hypoventilation. So it will be stimulated to balance acid-base balance. So the body will be in the state of hypoventilation to compensate the body that have run to the state of what? Alkalosis. So in order to compensate the body for running to the state of alkalosis, there will be what? Hypoventilation. While in this one, the former one, to compensate the body will be in the state of what? Hyperventilation. And so hyperventilation raises the plasma level of this. You know, these guys and water are the one that form carbonic acid. You know, hyperventilation means the body is highly alkaline. So what will happen now? Now, there will be more pressure of this CO2 and water to form what? This acid. It will be increased in the body. So as to balance the body to return to what? The normal ratio of what? This conjugate base to acid, with the body return to normal pH of 7.4. So, and the process continue like that. Thank you for listening, and if you have any question, please don't hesitate for us to meet in class so that we can explain it better.